Hi, my name is Jeff Geet. My wife and I are part owners of Aventa Senior Care. Thanks very much for your interest in our company. We're very fortunate to have a great group of people that we work with. They're caring and they're compassionate and they really have a passion for providing the best possible care for our clients. So we'd like to just give you a look at who some of those people are and give them a chance to voice their opinion as to what Aventa is all about.
I think I really like working in home care because of the family aspect it gives to the clients and the client's family. I feel like they're more comfortable with us as caregivers coming into their space as versus a hospital or a care center. I think in hospitals and care centers it's more of where they're only for medication and taking care, but in a home setting we're there to encourage them and make them feel better.
I love working in home care. I think it's a great opportunity to serve the needs of the elderly who have actually paved the way for us to be here today. And ever since I was small, I've always had a great compassion for the elderly. So it's a way to give back and to find fulfillment in a job.
When I first started with the client I had now, she wouldn't really talk or vocalize any of her needs or wants or likes or dislikes. So it was really hard trying to thread out the things, even foods that she would eat or wouldn't eat. And one day we were watching the news and something came up about flowers and her eyes just lit up and she started talking about how much she loves gardening and flowers and watering them, watching them grow. So the next time I went shopping for her, I bought a little flower pot and some seeds and we planted them together. For the next few months we watched them grow and it was easy for us to be able to connect at that point. So now we have a really good relationship and she never stops talking now.
I have fun in healthcare, I do. I try to make it about a homey perspective, interacting with the client. I mean, they basically do become an extended part of your family. So if you're gonna have fun with your family, have fun with who you're with. For the time that I've been with Aventa, they've had ongoing training in the office, classrooms, we've had computer training, when we're on the phone with people. It's been nice to have ongoing education and support from not only the management, but the nurses, and to be able to implement that into the homes of the people that we care for, it's a benefit with Aventa.
Several years ago, a good friend of mine, Todd Knuckles, came to me with an idea. He was very passionate about this idea, and it had to do with what was really needed in the senior care community. You see, Todd is a firefighter, and he saw firsthand there was a real need for caregivers who could provide the right level of care for seniors. Todd came to me and he said, look, we need to make a difference here. This is an area that we really can make a difference. We need to start a company where we can provide a higher level of care for seniors. And now I'd like you to hear from Todd.
As a fireman, we'd walk into the homes and these caregivers wouldn't even know the names of the person they were taking care of. We would ask for medications. They wouldn't even know where their medications were. To me, that was a problem.
One of the concepts that Todd was really passionate about in starting this organization was to make sure that we were a nurse-managed organization. And really the reason that was so important is we felt who could provide better care for seniors, who could provide better guidance for that care than nurses. Nurses that could provide the initial assessment of the clients, that could provide the training for the caregivers, that could be there as a resource for both our clients and their families whenever they had questions. That was very important to us. We felt the only way we could really get the care right and ensure that the best care was being provided was to have nurses be involved in all aspects of our operation.
Nursing is something that was downloaded into me in early childhood. My mother was a nurse. My first job was as a caregiver at the age of 15, actually, in an assisted living community. So this is something that's been a part of me as far back as I can remember. Going through my nursing experience, I've worked in skilled nursing, I've worked in the hospital, I've worked in wound care, and what I found was that home care, and especially with Aventa, was really the best fit for me. This was an opportunity for me to take families who really have no idea what their next step is going to be. Most of my calls are people saying, look, I don't know what to do. And getting them to understand that not only do they have options, but they have somebody that's willing to take their hand and walk them through those, because it's not enough just to give someone information. You really have to guide them the way that's right for them, and you can't do that until you understand what their situation is. So when I met the owners of this company and realized that their passion for helping people and their recognition of the importance of nursing was so in line with what my philosophies are as a nurse, I just knew it was going to be a good fit. And we've really been able to help people that we take care of and getting them educated to what their options are and really walking them through this very difficult system. Working with the caregivers, Caregivers are people who have a passion for helping others as well. They've just not necessarily been trained in how to do that. So the caregivers that we bring in are people who are very caring and passionate, and they want to help people, and having that nursing component available to them to teach them on how to do that. You know, how do you take care of somebody with Alzheimer's? How do you take care of someone with diabetes? That's what Aventa stands for, is making sure people understand their options, know that they have options, and to teach our staff how to care for people the way that they want to.
The goal of a fireman is to serve the community. Jeff and I's goal as Aventa Senior Care owners is to not only serve the community, but to impact and improve the lives of seniors and our staff.
If you're looking for a nurse-managed organization, let us be your advocate. Contact us at Aventa Senior Care.